Tell us more about Mars.
Mars is one of the most advanced forms of treatment of prostate cancer that we've developed at MD Anderson. This is called MRI-assisted radiosurgery, initially developed utilizing the most advanced form of imaging tools for brachytherapy, which is the insertion of implantation of radioactive seeds into the prostate with radiation to help ensure the highest dose of radiation to kill the cancer, but also improve the quality of life. What Mars offers is the ability for MRI to be used from diagnosis to treatment planning to treatment to post-implant assessment. And MRI is critical in the management of prostate cancer because it has the best soft tissue information. Historically, we simply use ultrasound or we use CT scans, all which are inferior imaging modalities, and therefore they do not give us all the information that is necessary to see the intraprostatic lesions, where they're located, which can only be done utilizing MRI. It also doesn't give us good anatomical definition of the external urethral sphincter, which is that critical structure that helps minimize the risk of incontinence or urinary irritable and obstructive symptoms. It also gives us better visualization of the bladder neck, which is important to help minimize the risk of bleeding following the treatment for prostate cancer. And then the relationship of the prostate to the seminal vesicles, the erectile function mechanisms such as the neurovascular bundles. These can be seen with MRI. And also to ensure that we miss the rectal area adjacent to the prostate, which is important to minimize the risk of additional side effects associated with rectal bleeding. MRI is an important quality assurance metric that should be utilized in every step of the quality assurance process during treatment.
Is Mars exclusive to MD Anderson Cancer Center?
It is not. Mars can be utilized in any center that has access to MRI and radiation. We've published those results. Initially, as I said, we did this with brachytherapy and low-dose rate brachytherapy. We're now able to incorporate this into high-dose rate brachytherapy. We've developed specific technologies around a cobalt complex that we have developed as a positive MRI contrast agent. And we've spun that technology into 3 FDA-approved products through a company called C4 Imaging, which was spun out of MD Anderson to develop these technologies to allow for us to advance MRI imaging into the treatment planning. And those products allow for localizing exactly where the radiation is going, planning with more precision to ensure that patients get the most precise form of delivery of the treatment and also minimize those side effects.